Okay. Alright. Hello, my name is Claire. How can I address you today?
Alyssa.
Nice to meet you, Alyssa. We're going to be doing a heart exam today, so I'm going to have you lay down at a 45-degree angle here.
Okay.
And this would typically be performed skin on skin or with a gown open in the front, but because of the current circumstances, we're going to have a shirt and just work around it. So, alright. So I'm going to start with just general inspection. I'm just going to be looking at your lips, looking for any cyanosis. I'm going to have you hold out your hands for me. Just looking for any clubbing, any splinter hemorrhaging, and any cyanosis of the fingers. All looks normal. All looks great.
Good.
I'm going to sneak behind you here. Grab my ruler and tongue depressor, or straight edges. I'm going to have you turn your head 45 degrees that way, and I'm just going to be placing my fingers right along your SCM here. I'm going to be finding the internal jugular, and I'm going to place my straight edge at the level that I see percussion or movement, and then I'm placing my rular 0 side down on the sternum, and then looking to see if it's below 3 centimeters, which would be the normal range, and it's about 1, so you are good. Nice and healthy. Nice. I'm now going to take my pen light here, and I'm just going to have you open up your shirt just a little bit so I can see the chest area. I'm just going to be shining a tangential light here, looking for any pulsation or any abnormal heaves or thrills, which I'm not seeing anything. All looks normal. I'm going to, let's see here. Okay. I'm just gonna have you open it just a little bit here. I'm just gonna sneak down to the apex of the heart. So I'm gonna be again just shining a tangential light, looking for any heaves or thrills of the apical region. And I'm gonna have you lay on your left side a little bit here, about a 45-degree angle, into left lateral decubitus. Again, shine that light, and then I'm going to place my fingers over that spot. That's okay. So it's gonna be super cold. Just feeling for pulsation and not feeling any abnormal pulsation there, so you're good. All healthy. Alright, I'm gonna have you roll back onto your back here. I'm just gonna be placing my knife edge contact over your sternum here, just palpating for any abnormal percussions or any heaving or thrilling of the heart. And all feels normal. Alright. So now we're going to be doing some percussion. So I'm just going to be placing my fingers at the level of the 3rd, 4th, and 5th intercostal space. And then I'm just going to be moving my fingers up over your sternum, listening for a change in the sound. So this would typically be done skin on skin, but we'll just go for over the clothes for now. It was about there, just about the apex of the heart, so we usually expect it to be a little bit past the midclavicular line. Up a little bit here. About there. I'm gonna have you just rebrush tissue up a little bit. Thank you. About there. All sounds normal. So now we're gonna be listening for the heart sounds. So I'm going to again, or I'm gonna start with actually palpating for some thrills. So I'm just gonna be placing my fingertips over the 4 areas of the heart. So I'm gonna be placing them first here on the left side of the sternum at the aortic, and over to the pulmonic, down to Erb's point, and we create a tissue barrier here, tricuspid, and then reaching around here for the apex of the heart again with the mitral valve. I'm not feeling any abnormal heaving or thrilling. So I'm going to be listening for those same spots here with my diaphragm, and then I'm going to come back and do the reverse with the bell of my stethoscope here. Thank you for keeping up that tissue barrier. And I'm just going to reach around you here. Perfect. Switch it to the bell here. Place that over the mitral, tricuspid, Erb's point, pulmonic, and then back to the aortic. Alright, next I'm going to have you sit up and face that way for me. I'm just going to come around to the front here and listen to the aortic valve. Okay. So I'm just gonna have you take a nice deep breath in as I listen to the aortic valve here. All right, I'm gonna take a nice deep breath in. Perfect. And I'm listening for a split in the listening for a LePew sound of the aortic, which would indicate valve stenosis. Next, I'm listening for the mitral valve, so I'm going to have you lay on your side. All right, so I'm just gonna have you create another tissue barrier here for me. Placing this over the mitral valve. I'm gonna have you take a deep breath in, exhale out, and then hold it for me. Perfect. And in that case, I'd be listening for an extra loud lub sound, which I did not hear. I'm gonna have you do the same thing again. I'm listening for that same spot, but I'm gonna have you bear down like you're straining at the stool or blowing up a balloon.
Okay.
So exhale out and then bear down. Perfect. And at that point, I'd be listening for a mid-systolic click, which I did not hear. I'm gonna have one more special test. I'm gonna have you sit up again. Whoop. Okay. All right, so again, placing my stethoscope here, I'm gonna have you take a deep breath in. And out. Perfect. And now I'm just listening for a split in the S2 sound, which I did not hear, so sounds like a normal heart exam, and you're all good to go. Sounds good.